Hi kids, just popping in with an update to let you know everything is shaping up nicely for Christmas Eve. Santa, Mrs. Claus, and all the eligible elves have had their booster shots. Santa is well kitted out in the best layers of protection. His mask is well fitted and the sleigh is naturally ventilated. So I am happy to report that Santa has the all clear to take off.
Tamara Ugolini here with Rebel News, wondering if you remember the investigation I did into Chief Public Health Officer of Canada, Theresa Tam's Christmas video, dating back to 2022, when Mrs. Claus, a Christmas classic character, was exploited by Tam to ensure that Canadian children knew the importance of COVID-19 vaccine uptake. At that time, the Public Health Agency responded to our access to information request by saying that, quote, no responsive records exist, end quote, and it was an entirely, quote, in-house production, end quote. But I have newly released documents that show a lot of paid staff time was devoted to 369 pages of bureaucrats arguing back and forth about whether Christmas trees were offensive and other ridiculous blunderings. All of this is made possible through your generous support and donations at rebelinvestigates.com. So thank you in advance for continuing to ensure that we can bring you these very same kinds of reports. Now, before I get into the response and the government documents, here is some additional context. Interestingly, this past Christmas in 2023, the agency opted not to put out a child-geared, propaganda-laden, vaccine-pushing, video-exploiting Christmas, even though they had been doing so since 2020. In 2020, Tam declared Santa an essential worker and cleared him to work on Christmas Eve. Look at this clip.
Just less time to build. I actually have something for you today.
Oh, what's that?
I would like to officially declare you an essential worker in Canada and clear you to work on Christmas Eve.
I am so glad to hear that, Theresa. Ho ho!
In 2021, Tam also cleared Santa for takeoff with his layered protection, masked and, of course, boosted. And she discriminated against poor Rudolph because of his red nose by forcing him to take a COVID-19 test. Again, have a look at this.
I'm also happy to report that all of the reindeer are healthy and symptom-free. But just to be extra sure, Rudolph has had his COVID-19 test to confirm his red nose is not a COVID-19 concern.
In 2022, the video of this subject report, Tam called Mrs. Claus for a health check where Santa's notorious nice list was propagandized to push vaccine marketing on children and their parents. Here it is.
Of course. I must say, Dr. Tam, it just warms my heart to see everyone in Canada, especially kids, working so hard to keep the holidays safe and cheerful for all.
So am I, Mrs. Claus. Every child in Canada has definitely earned a place on the nice list. Their parents and caregivers too. It's been a tough season with lots of viruses making people sick.
Thankfully, Santa and I are feeling as healthy as ever. We are both up to date with our vaccinations, including COVID boosters and flu shots.
That's so good to hear.
I always tell Santa to make a list and check it twice. 1, stay up to date on your vaccinations. 2, wear a mask in crowded indoor places and make sure it fits nice and snug. 3, wash your hands to the tune of jingle bells, jingle all the way.
Great advice. Great voice too. Also, you can be sure to stay at home if you're feeling sick. And if you're gathering indoors with other people or elves, open a door or a window for a few minutes at a time to let in some fresh air.
After we filed an access to information request to determine how much of the taxpayers' dollars were being allocated to this nonsense, the agency responded that the video in question was produced in-house and therefore there were no associated costs concerning the production, development, and distribution of this video, if you can believe it. In the words of Maury, the lie detector test determined
That was a lie.
A newly released 369-page document shows that paid bureaucrats went back and forth on the script, video edits, the backgrounds, and the lines rehearsed over and over again. They spent time arguing over how to translate "om" and how and if to make multiple versions of the video, not just in our two official languages, French and English, but longer and shorter versions fit for sharing on various social media platforms. It seems like a lot of paid staff time was devoted to this 2-minute clip by people worried about whether the word Christmas and Christmas trees specifically were being considered offensive. Page 1 confirms the amount of time wasted on this project. Let's dig in. On November 21st, 2022, Sean Upton, manager of video services at Health Canada, writes, "The setup for the exchange between CPHO, that's the Chief Public Health Officer, i.e. Theresa Tam, and Santa took a lot of prep and a lot of post-production work. We'll need to get a clearer picture of the final product in order to be able to estimate the amount of time we will need." Page 2 shares the editorial direction from the 2021 video, meant to leverage holiday traditions to reinforce public health messaging, and was geared toward parents and caregivers of children ages 10 and under, including children's hospitals and healthcare networks. Page 4, another comment asks here if Mrs. Claus should be the one giving health advice and not Tam. Also, anecdotally, cool designs probably make masks more enticing/fun to wear for kids. But this advice is later condemned on page 21 as a bureaucrat named Kathy L. has to confirm if holiday pattern masks are Health Canada authorized products. On page 9, a comment says it would be more empowering to have Mrs. Claus giving the health advice. Also, they want to include that Mrs. Claus works on the sleigh to somehow promote girls getting into STEM. Page 6, approvals include Christina Lawand, a former CBC reporter who was found by the CBC Ombudsman to be selectively editing Stephen Harper clips in 2006. I guess at least we know she has lots of experience editing videos.
It appeared as if the Prime Minister was responding directly to that particular protester. In fact, he was responding to a general question from a journalist about public reaction to his stand on the war. We did not make that clear. We should have, and we regret that we didn't.
Page 10 talks about the script and the dialogue between the two characters, so I guess Tam is a character, just like Mrs. Claus. Page 13 says, "Hi, Mrs. Clauses," and in there it looks like Nancy Hughes, who is the communications and speechwriter, as well as deputy head and ministerial internal engagement with Health Canada and the Public Health Agency of Canada, is the person who played Mrs. Claus. On page 24, Upton also sends an email to Hughes informing her that the recording would take up to a good part of the day, roughly 10 a.m. to 4 p.m., as there would be two sessions, one at noon and the other at 3 p.m. On page 25, Hughes thought that this little project would be a hoot and was happy for a nice little break from the ordinary. Page 31, they intentionally don't specify how many extra doses we need, so kids aren't wondering why they don't have their 2 boosters. Page 37, thanks Nancy and team for putting up with multiple takes. Page 49, Director of Strategic Communications at PHAC, Christina Lawand, that former CBC journalist, is confused why Christmas trees are banned. "I don't understand about the no evident Christmas tree," she says. "I was okay with removing the word Christmas, but I don't see why this should extend to not showing a tree, as these are absolutely everywhere and non-controversial even for non-Christians." Page 91, Tam is very concerned about how her title is shown on screen and wants it to be possessive, Canada's chief, as opposed to Chief Public Health Officer of Canada. Page 101, Lawand worries that Santa might have said not which she thinks implies Santa doesn't want to talk to Tam. Says instead of as Leslie suggests. This may signal that Santa is trying to get out of talking to the doctor versus yoga. This is really strange. Page 324. So few people watched Tam's previous Christmas video that they aren't even going to bother creating a described video version. Given that the performance analytics were low last year, a described video version is not required. This absurd misuse of taxpayer funds makes it abundantly clear that the agency supposed to be entrusted with safeguarding public health will shamelessly divert resources to propagandize Canadians and their children. As reported by the Canadian Taxpayers Federation, the average annual compensation for a full-time federal bureaucrat is $125,300 per year, according to the Parliamentary Budget Officer. And if that works out to roughly $500 per day after vacation and holiday time off and so forth, with at least 10 different bureaucrats partaking in this fun and cheerful pet project, i.e. a child propaganda video, that's at least $5,000 in salaries just for the one day of filming. But despite the Public Health Agency of Canada developing a regulatory openness and transparency framework, they're trying to hide how much this in-house pet project truly cost the taxpayer. For Rebel News, I'm Tamara Ugolini. Bureaucrats dedicating extensive time to arguing over Christmas trees and propaganda scripts exposes a concerning lack of focus on genuine health priorities under Tam's guidance. That is why we have launched a petition and special website at firetam.com. If you agree that Tam should be fired, then please head over to firetam.com, sign the petition, share it, and of course, like and share this report. Thank you.